Yes, because it goes through.
Opioid settlement, please.
And then I figured if
Yeah.
she needed to. Yeah.
Thank you.
Yes.
Opioid settlement.
Thank you.
Yeah, yours was good. Kathy sent it to me too, so. That's yours, right, Kathy? Turn around. Yeah, I'll sit there. Yeah. This is Nicole. Nicole's the deputy director.
Who's in charge of this thing?
It's hit by a bus, Nicole's in charge.
Kelly?
No, wait.
She's already.
Okay. She is in charge.
Jen. Oh, it's 5 o'clock.
How many more women do they want?
Look around.
Jesus, God.
I would like to call the Human Services Committee meeting to order. It's April 4th, 2024. Is there anyone from the public that would like to address the council? Okay. Second on the agenda is report from drug and alcohol. First up on the opioid settlement.
I'll get these. You want that? Oh, you can have all that.
I feel like I'm really far forward here today. Okay. Well, as Sue passes out some goodies, do you want me to introduce myself or anything?
Yes, please.
Okay. So I am Kathy Durley. I am the administrator of Northampton County Drug and Alcohol.
If you don't, I'll give it.
And I have prepared, Sue is passing out some of our fake is real items that we use for outreach events, which I'll get into in a little bit. But I wanted to take this opportunity to go through our opioid settlement to just explain a little bit about what we are doing with drug and alcohol and let you know how the campaign is going so far. So the fentanyl awareness campaign is fake is real. So you are getting Narcan pouches and some other swag that we are passing out at various events. We started a billboard campaign initially, but fake is real is very much more than just a billboard. If you haven't had an opportunity to check out our fakeisreal.org site, I encourage you to do that. So the fentanyl awareness campaign was launched January 31st of 2023, and we just recently celebrated our 1-year anniversary. The campaign was aimed at raising awareness to the dangers of fentanyl, as well as providing resources and statistical information for the community. So fake is real by the numbers. So 15 is the number of Narcan trainings that our office has held with providers for county staff, for the community, for school professional, for other professionals, so far from 2023 to January of 2024. 286 is the number of individuals that were trained in Narcan, and they now know how to safely administer Narcan in the event of an overdose. 1378 is the number of Narcan kits that were distributed, many just like those Narcan kits that Sue has handed out to all of you. 14 is the number of events attended by Fake Israel in the community. 131 is the number of agencies that have received Fake Israel materials, rack cards, posters, and other informational material to display in their offices or hand out to the public. 96 is the amount of requests that we have received through the Fake Israel site for Deterra, for Narcan pouches, or for trainings or other things related to fentanyl awareness. And 50,047 is the number of homes in Wave 1 that received Deterra pouches. And I'll explain a little bit more later what the Deterra pouches entail. So in the beginning, we did a billboard campaign and we learned what fentanyl was, and we educated the public on the dangers of fentanyl. So you may have seen some of these billboards along 22, along 78, and some other places. First, we were learning that fake pills can kill, and you'll only be dead wrong once. Then we learned that that much fentanyl to balance on the tip of a pencil is how much fentanyl it would take to kill you. Then we learned that 7 out of 10 pills can be laced with fentanyl. And then we learned that 54.4% of drug overdose deaths happen in a person's home. So there were additional billboards, but we're not highlighting those right now. We also partnered with Lafayette and Lehigh to do an event at the Lafayette-Lehigh football game, where we got both schools together and we were educating the students and the staff and families on fentanyl awareness. We had the campaign say that everybody was rivals on the field, but partners in the fight against fentanyl. We did a short YouTube ad, which I cannot play right now, but you can look, it's on YouTube. So we are actively seeking out high schools and colleges to get our message into those arenas. So some more of the highlights were for Fake is Real. We are doing Narcan distribution, Narcan training, community outreach events, and school-based programming. So pictured there is my staff on the left that was manning the Fake is Real table at our Live Well, Be Well event that was held in September. That was our suicide prevention and drug and alcohol awareness event. And on the right is myself and the assistant administrator with Kevin Hines and Wes Morris, who spoke about attempting suicide and drug and alcohol overdose and their history with mental health and addiction. So this is a copy of our rack cards, which we were distributing, our posters, which you may or may not have seen all over town in the courthouse. And this is a newly created portion to our website. We have created a fentanyl awareness memorial. So folks who have lost someone due to opioid or fentanyl overdose can go onto our website, our Fake Israel website, and highlight a picture and the location of where their family was from and if they have overdosed, and write a short little message about, a life lost too soon, struggling with this horrible disease. So again, I encourage you to go onto the website and check out all of these details. So recently we have launched our Narcan boxes. So Gretchen and I are pictured there with one of 10 of our Narcan boxes. They are placed in 10 locations right now throughout the county. We have distributed 495 doses of Narcan in February and 302 doses in March, just from those 10 boxes alone. Boxes that are indoors or outdoors maintain a 3 to 7 day supply, and that is in accordance with the manufacturer recommendations. So most of the boxes are located outdoors, so it is easily accessible to the public during after work hours. It's not behind a locked door where people can't access it. So talking about our Deterra campaign. So our Deterra campaign launched in November of 2023. And what we did was we took one of these pouches and we sent it to 1/3 of the county residents, the county households in Northampton County. Totally based off of a random sample of zip codes throughout the county. Folks were getting this so that we can help eliminate pill misuse. Folks getting a hold of prescriptions that are no longer needed, folks who have someone who has recently deceased, who don't know how to dispose of medications, or folks that never finished taking a prescription that may be abused later, extra oxy from a dental procedure or something like that. You can simply rip off the top, put the pills in, add water, close it. This is biodegradable, and you just shake it up and put it in the trash. So this went out to 1/3 of our county households, and in April, the other 2/3 are going out hopefully by the end of April. So all county households should at least have one of these. But these can also be requested through our Fake Israel website. The response we've gotten from them has been overwhelming. There have been a lot of folks calling our office saying that they just had a family member pass away and they didn't know what to do with their medication. And they were very thankful that this came because they didn't know what to do. If everyone in the county used the one pouch this size that was mailed to them, it would eliminate 6,394,050 pills. Deterra can be requested through the Fake Israel site in addition to any of the materials, rack cards, or items that were distributed here today. So this just goes over what I had already talked about with placing the medication in the pouch, filling it halfway with water, shaking and disposing of it. It's just that simple. So one of our other plans for our opioid settlement money is our mobile outreach vehicle. So the one pictured is called Hope One. Ours will not be called Hope One, but I wanted to give everybody a visual since we've been talking about this for what seems to be like years. This is to provide mobile assessments in the community, to provide folks with access to treatment, provide resources, and link the community with mental health, physical health, and drug and alcohol treatment. So we did just get off a call today. It looks like the completion date for this vehicle will be the end of December. So we are anxiously awaiting to see the final product and get folks on this vehicle. Some of our future plans include enhancing and expanding all of our 5 Northampton County recovery centers and ensuring their sustainability throughout the upcoming years, expanding veteran services and programming, enhancing services for certified recovery specialists and embedding them in college campuses as well as our children and youth division, expanding recovery housing, expanding school-based drug and alcohol services, and creating an adolescent recovery center. Some important items to remember with the opioid settlement is that all programs and projects are paid for with the opioid settlement dollars must fall under Exhibit E. That is a list of the approved opioid remediation uses set forth by the PA Opioid Trust, and all items must be related to that to be able to use settlement funds. Settlement funds must be spent within 18 months after they are received, and the amount of funding received each year varies from year to year. There are reporting requirements on all of our opioid settlement funds, and we must detail exactly what we are spending and exactly what we are spending it on every 6 months for the state. And that is all I have.
Any questions?
If you don't mind, I find it fascinating that with the Deterra pouches, that we're able to actually get a number of over 6 million pills that you stated during your presentation. How do you come up with that particular number?
So there's 3 different sized Deterra pouches. There's one smaller than this. This is the medium size, and there's actually a larger size, which is about this big, and there's actually like bulk ones for like nursing homes. So based on the 40 or 45 pills that this can hold, they times that times the 141,000 households.
Gotcha.
And that's how they came up with that number.
Okay.
Now, granted, the requests that we're getting through the website, people are asking for multiple, 3, 4. I mean, we had a box of 200 in our office, and we've easily gone through half of it. So folks are really using this and disposing of medication in mass quantities.
That's great news.
We are offering a Narcan drive-through in May at Arts Quest. We've also combined that now with a medication take-back and we're partnering with the sheriffs to do so because of the overwhelming response that we've received, that folks just, they want to get rid of medication so it's not improperly used.
All right, great, thank you for that. And when you were talking about future plans as well, expanding recovery housing, is there any way, are there any more details on that? Because it's something I think that's obviously needed and a huge component of the equation as we are combating this terrible phenomenon. So do we know what that looks like yet in terms of long-term plans?
So I don't. So we do have a couple of current providers that are providing recovery housing. So we're always asking them if they're willing to expand or what they're willing to do. Although keeping that in mind, DDAP does have licensing requirements, so we want to make sure that all of our houses are licensed houses, they're following all the rules, and they're not just some half-hearted fly-by-night, shady kind of, you know. We are looking at other providers from other counties who are interested in expanding to this county, who are doing really good work in other counties, so I have been in contact with a few of those. Everything is still in talks. Nothing, you know, no pen has been to paper, no dirt has been moved in the ground. Everyone understands the need, and a lot of folks are willing to explore it, but the cost of housing right now is not feasible for some of our smaller providers to undertake this.
Yeah, complex process for sure.
So, I mean, we're working on it, especially with some of our bigger providers. It's just, it's not as simple as, we'll just buy a building and just turn it into apartments, you know? I wish it was.
Yeah. Anyway, thank you.
Anybody else?
I think that you guys have done an excellent job with the prevention efforts and all the creativity that has gone into that. And I also appreciate the recovery side, you know, the recovery centers, and they do so much more than what I think they were ever originally intended to do. But what about the actual treatment side of things? In terms of access to beds or expanded programs that are just treatment specific? Like, I know some stuff is touched on at the recovery house, but again, that's not really treatment by licensing standard. It's
Yeah.
support, self-help support a lot of times. So how can we start to use some of this money? I mean, I guess the vehicle will begin to identify and do some of that assessment process, but
Correct.
what else have you thought about? And maybe it's 2 or 3 steps down the road, but what are your plans for that?
So we are looking at our current providers and what additional services they can expand upon. We've already started looking at our RFPs for next year, looking at where we can enhance case management, we can enhance outpatient services, we can enhance CRSs within our community. I've realized that we have a lot of CRSs tied to programs, and that doesn't necessarily allow for folks who aren't in that program to get access to those services. So we have already made some of those decisions. Now, we have funding available, treatment funding, that we don't necessarily need to use opioid monies right now, but we certainly could if we needed to expand into the treatment realm. But right now, DDAP is giving us an ample amount of treatment money, so that's not an issue.
But is there, I guess, how do you feel you're poised to have access to things? Because I know everywhere else, mental health and other kind of things, it's hard to get in, or people are waiting for beds at times. So, and especially for people who don't have insurance, I mean, I know it's a lot of, so, I mean, I guess I'm thinking from a, maybe not just a money, but an access perspective.
So right now, we are not having any issue with access to beds. There is no one on a waiting list. There is no one that can't get into a facility. You know, the only wait we have generally is prisoners coming out of prison, getting into a bed at a facility, and that is more a holdup on, you know, the prison end and when they are allowed to be released than when we can get them into a bed. But yeah, we haven't experienced, I mean, even the most difficult folks to place, usually within 24 hours, we have them placed in a bed in a facility.
Thank you.
Anybody else? Okay. If you want to move on to, is there a second part?
Yeah, so Sarah Clark from Kudu has the second part of the presentation. She's just going to go over a little bit more about Fake is Real and more of the deep dive as far as what we are doing with Fake is Real and the analytics behind all of it. So I will let her do her thing. How do we switch it to her PowerPoint? So that would be this. Okay. So I'm not sure how you want to set up the pages.
Do you have enough?
Good evening, County Council. How are we tonight? Good. Thanks for having me. I'm Sarah Clark, the owner and creative strategist at Kudu Creative, which is right down the street on Wood Avenue. I've been working alongside the Drug and Alcohol Department now for over a year, and I must say we have been making a lot of progress in reaching our community, especially Northampton. So I am here to reiterate what Kathy had mentioned about this campaign being more than a billboard, right? So the first step is awareness. How are we going to make the community aware that this is present and that there are resources available? So billboards are wonderful to do that. But now that we've felt like we've reached a certain amount of exposure and impressions, we start to add other marketing strategies and tactics to then reach those people. And just a thing about psychology, the more they see it, they might not see it the first time, but if they see it multiple times, then it starts to stick. So our website is our base camp for our information and our resources that we are sharing with the community, also schools and business owners and parents as well. So what Kathy had mentioned with the doTERRA pouches and the Narcan kits, they're all on the website. We also have downloadable materials for teachers and parents. So there's PowerPoint presentations there where you can have that conversation with someone, whether it be a child or a teenager. There are questions to help them, get them to open up and understand. So the billboards were the first sign of awareness and action towards moving forward. We started our email monthly newsletter, and as I was sitting here, we had one sign up. And we've been catching a lot of signups more and more. So at first, our first year, people were starting to submit, but it wasn't as frequent. Now they know we're here. We are getting submissions for the newsletter. Also, of course, the materials to help dispose of unused medications. So our click-through rate began at 11% and now we're at 20%. So within these newsletters, we provide a little various menu offering of what we're focusing on that month. So we're letting them know that the distribution boxes are out. So we have links to all the sites that they're located. We also list in there what our next Narcan training events are for the month. We also do a blog as well. So the email right now is our most successful way to reach people, just because of click-through rates, and they're already interested because they signed up, right? So it's a warmer lead. So currently we have 293 email deliveries, which is good, but I would love to see that number double by next year, just because it's like a snowball effect. Once people catch on, it goes up fast. So we're growing to about 20 to 30 signups per month, which is really good. We're doing digital marketing, so we're doing YouTube ads. We're also doing social media ads. We have a media buy with Morning Call as well, so they are helping us with the distribution lists for emails, and it's only targeted at Northampton County. So right here, you can see a heat map of our Northampton County zip codes and their access to clicking on YouTube display ads, clicking for free Narcan, or downloading a free guide for parents. Our social media campaign is doing really well as well. We have 91 followers on Facebook and 258 on Instagram. So the thing about Fake is Real is because of the content and the nature of the subject matter, it's not going to grow as fast as a gardener. So what we do is we have this as a base camp for information, resources, and our events to get the word out. It drives them back to the website to either sign up, download, or submit their information for free marketing materials, educational materials. And I thank you for listening. If you have any questions, let me know. If there's any specific analytics you would like to know, I have access to those as well. Thank you.
Anybody have any questions? No? All right, thank you so much.
So I have some stats for you that Kathy had in, not in the PowerPoint, but that we wanted to share. So this is from the Pennsylvania Department of Health, the Office of Drug Surveillance and Misuse Prevention. And it's the drug overdose deaths among Northampton County residents by year from 2012 to 2023. Only 2023 was, I think, through November. So drug overdose deaths in Northampton County peaked. This is since going back to 2012. In 2017 at 109 overdose deaths. Then they kind of went up and down a little bit. In 2020 and 21, there was 94 and then 96 drug overdose deaths. 2022, there were 81. And as of November of last year, there were 45. So there still will be some added to that final number. But I think certainly indicates a strong correlation between the reduction in overdose deaths and the Fake is Real campaign and all of the efforts the Drug and Alcohol Department is making. So we know it's not causation, but certainly a real strong correlation between those two. So I just wanted to make sure I shared that. Any questions about that before I give you my short report? Okay. Really, I don't have a lot this month, but I wanted to update just a couple of things. I said last month that I would provide some information about being out of civil service and how long the hiring process takes and how many folks we've hired. So HR only has anecdotal information from when we were in civil service about the how long the average time was from application to start date if somebody was hired. But we know anecdotally that there were a lot of folks who that could have easily been a 4-month process. And so really one of the biggest things is when somebody would apply through civil service, first they would apply through civil service. Civil service would run that posting for 2 weeks just like we do. Then they would take however long they took to sort through all those applicants to see who met the minimum education and training requirements, and then they would score those to rank them, and they'd send them to us accordingly. And that's one of the biggest delays that we face, just because of the administrative time that would take at the state. And then on the flip side, when we were still in civil service, once we chose an applicant, we would have to send their information back to civil service to say, can you certify that now we can move forward with this? So it was just very cumbersome. So now we started in August of last year out of civil service, and the average number of days from application to start date was right around 48. So that's still high for me, but obviously it's a lot better than it had been. I'd love to get that to 30. I think realistically, that's going to be a big challenge because of clearances and FBI clearances in particular. If I have learned, because I had to redo mine every 5 years, if you get the fingerprints done digitally, you can have the results within like 2 or 3 days. If you don't have a criminal history. If you have a criminal history, it takes longer. And folks who don't have access or don't go to a facility that does digital fingerprinting and they still do the paper cards, those usually take at least a few weeks. So realistically, still somebody applies, and if they apply the first day it's posted, it's 14 days until that posting comes down. But they're able to see that their application was submitted right away. So they're not having to wondering about that piece of it. And then from there, HR, I would say from the time a posting comes down, within probably 2 days, we're having the applicants already scored and sent to us for interview. So we are making some really good progress there, and that will continue. I wanted to tell you, from August through December, we hired 30 individuals, and in January and February of this year, we hired 16 individuals. So I don't have March's numbers yet from HR. So we're getting there. We're chipping away. Any questions about that?
I have a question.
Can you send them to the prison for their fingerprints? Because we have the machine to do it instantly in intake, the digital fingerprints.
I'm not sure if you're joking or not.
No, I'm not joking at all.
Okay.
Probably not.
Because we have people come in there a lot to get their fingerprints taken for, different departments, not from the county, but outside of the county. And there's a possibility because we have the machines in intake.
I certainly can look into that. Thank you.
Because you can do that and get it right away.
Yep. There's also, I went to, it was like 10 minutes from here in Bethlehem, and they did it, 10 minutes from my office, and they did them digitally, and I think I even got them back the next day. So it's much better if for people who have access to that. So I'll look into that. Thank you. Other questions on that? Okay. The only other thing that I really wanted to talk about, some of you are familiar with the complex case issues that Northampton County and every other county in the state has and throughout the country, which we've talked about briefly, I think already this year in terms of youth who have significant complex needs. So they're probably kids who are intellectually disabled or autistic and have significant behavioral challenges, or who are also experiencing significant mental health issues. The fire setting, the sexual reactive behaviors, those kind of issues that make it really difficult to find a placement for a youth where they can receive treatment to move forward and make progress. And so the state put together a blueprint work group last year, and at least 2 of my folks were invited to participate. So Lisa Gaiman, who's the Deputy of Developmental Programs, and Maria Torres, who's the CYF Administrator, participated in that last year. So the state came out with their overall recommendations for complex case strategies moving forward. CCAP came out with their own very similar and overlapping recommendations. And so now they've moved on to the next phase. And so my folks will be participating in that as well. And let's see, the goal now for this steering team moving forward is to consider the recommendations made by the Blueprint Work Group and the CCAP recommendations, and to build out the details of each one for the purpose of implementation. So just to give you an idea of who's included in that, there's representatives from across child serving systems, including DHS, county government, and associations like mental health, intellectual disabilities, and children and youth, family members, provider associations, behavioral health managed care, juvenile and dependency courts, and the education side of things. So they're starting in May, and that I expect will continue. So ultimately, I'm sorry, the primary recommendations that CCAP came out with that will be considered in, along with the blueprint, are a state development of a no eject, no reject program to ensure youth have a safe place to stay when there are no other options. So right now, any provider throughout the state can continue to say no to working with our youth, which I think is intuitive, but at the end of the day, we need to have some kinds of treatment facilities that sort of end up having to take these really complex kids, and they have to be built in a way that the staff have training and knowledge to support these youth. And we've told the state we're absolutely happy to participate in those conversations if they can find us some funding. Because I don't have that. So, we have a team that has some really amazing ideas, but they are expensive, and so we're certainly continuing to advocate for that. More organized and concerted efforts be made to develop programs, same kind of thing, to accept challenging behaviors, co-occurring medical and mental health issues, et cetera. Collaborative cross-systems trainings, regulatory and policy changes to enable existing funding streams to better address complex cases, state and counties leveraging technology to free staff time and improve outcomes by allowing staff to spend more time working with families. So I know we talked here last year sometime about our Dragon software system that Children and Youth implemented, which is a talk-to-text technology. They had something many years ago that was maybe mildly successful. The technology's improved significantly in the last decade for that. And so whether it's individuals who to my ears have a heavy accent or folks who don't, the technology is picking up on that. So one of our staff whose first language is Spanish, she made a joke with me about how it and I have to really listen to when we have conversations, but she said that the technology picks up on her accent, and so we're really excited by that. So folks, we try to do testimonials in Children and Youth to get more of the staff on board with that, but that's the kind of leveraging of technology to make things more efficient. So. Greater emphasis on improving state, county, and private staffing throughout child welfare, and develop a Pennsylvania mental health resource navigation system. So those are the CCAP work group summaries, and this next step in the process will be considering both sets of recommendations to move forward. So it's an invite only for that, so I'm really proud of the work that our team has done. I think part of the reason they were asked is because we are very vocal, especially with some of these particular youth, and we include the state in a lot of these conversations, but from really a strategy, trying to come up with productive solutions approach as opposed to just complaining. We know there's no easy answers. I tell my folks all the time that, most of the time, none of us in the room individually have the answer to any of these things, but some really great ideas have come out of the complex case meetings with individuals and children throughout all of DHS, so Children and Youth, developmental programs, mental health. Somebody will say something, somebody else will ask a question, and all of a sudden it leads to things that we've been able to come up with some solutions for some of these youth. So I'm really proud of them, and I'm excited to see what they get done at the state. Any questions?
I know you're looking at me because you know I have one.
Complex case.
No, it's great, and I think it's great that the staff is being invited because, it's a tough problem. And they are the subject matter experts, so they should be in the
Yep.
room. How many complex cases do we have to date? I know you gave me the number last year. Is it the same? Is it increased? And again, I don't know, do they ever age out? Because technically, they're allowed to stay till they're like 21 or later? Because
So not all of our
you don't turn
complex,
18 and then, oops, hands off.
yes, time to
You're
go.
You're somewhere.
Not all of our complex cases are, so they're all youth, but not all of them are involved with children and youth. So children and youth is on all of the complex case calls, but it's not necessarily somebody that children and youth has custody of. In fact, most of them are not in children and youth custody. So I would say that that all runs through our CASP coordinator, and she also coordinates the multi-system meetings. So when you have a youth who has all these challenging issues, they start with a CASP meeting, which stands for something that I can never, ever remember. But it's Child and Adolescent Serving System something. So that's like the first level. Or if it's a children and youth client, they would do staffing with supervisors and legal teams. If they don't get solutions out of that, then they move to this multi-system team meeting, which is all of folks from each of the DHS departments that talk internally. If after, I mean, there's no guidelines in terms of specific timelines, but if after a month or 2 months or 3 months, whatever, depending upon the issues, we still can't resolve them internally, that's when we move those to complex case. And so that's when the State Department of Health or Department of Human Services and State Office of Developmental Programs and such get involved. And then those folks are on our calls. So we really call upon them, not for solutions per se, but to try to help us be creative. If we could be more creative with funding that we have within our county already within DHS and how we could use that for some of these kids, we would be able to make some changes, but that has to come from the state. So
Well, I think that that's what they're proposing, and how to use the funding more efficiently is the big
Yes.
question, because it seems like it's being used to warehouse and one-to-one people rather than actual treatment and solutions. So I'm
Correct.
sure your people know that, but I'm asking specifically.
So the number, though, of
how
complex
many-
case.
Yeah,
So
do
I-
we have specifically that we're funding, and how many of them are we funding away from home and costing us?
I don't know that we have any that we're funding away from home. So there's probably about 5 true complex cases right now, give or take, 1 or 2. It just ebbs and flows. And so one of our most complex cases, I think we had that one going for probably almost a year, and a whole lot of things happened, but when push came to shove and the state got involved and contacted a provider directly, they were able to work with this individual. But during that time period, the individual turned 18. And so then it no longer was a children and youth. Children and youth had no placements for this particular individual. So it didn't matter, but under 18 is definitely children and youth. And so since the individual wasn't involved with children and youth, when they turned 18, then our Office of Developmental Programs was able to assist. But we wouldn't have been able to make that happen without the folks at the state intervening. They didn't want to have to they didn't want to have to be subpoenaed to come to court, so they were able to help us figure it out, so.
Do you feel that the adult side of developmental resources has more funding and more ability to handle that stuff when they do get to that age, or not necessarily?
Generally, yes, but the issue is that if you have, and Lisa Gaiman can come talk about this sometime if you guys would like, but we're talking about like the sort of the consolidated waiver. So if you have an adult, so 18 or over, who has intellectual disabilities and can't live at home, whether it's an older person and their parents are deceased, or the parents don't have the skill set to take care of them. Those individuals can live in life-sharing homes, which is sort of like foster care for adults with intellectual disabilities, or they can live in these really small, 1 or 2 person home settings. And so the consolidated waivers, we have so many of. I don't know how many, but I can tell you that there's about 70 adults on the wait list who meet the criteria to have a consolidated waiver, but we don't have them to give. So the way we get more is if the state says, like I think in the budget last year, they gave us like maybe 4 more. the only way we get them is when someone who currently has one passes away, truly. And so occasionally, the state will issue an emergency consolidated waiver, and then we get to keep that, if you will. But those are exceptional circumstances that, it's hard to imagine. So, like, I've seen the criteria, the 70 individuals, like in the criteria that we use to assess and make those determinations. So that's how many folks are on the wait list. And so under 18 youth end up, even if they would technically be eligible for one of those waivers, they're never going to rise to the top of the list. That one's not first come, first serve. That is absolutely like like physical, whether homelessness or medical issues, like physically need-based driven, that list, so. So we have a provider, for example, though, who's willing to work with youth who are intellectually disabled, but the funding streams don't allow that money to work with youth, and it's a different license for residential purposes. So this is where I say my folks have a lot of great ideas. We just need some help from the state to figure it out. Other questions?
Really quick, and
Yeah.
if you don't have this, it's fine, I'm just wondering the number of out-of-home placements, do you have that off the top
I
of your
do.
head?
It's right around 180 this week,
Okay.
down from
I was gonna ask from January to where we are now, do you have any idea? If you don't.
from this January.
Yeah.
We're at a plateau.
Okay.
Which is, I mean, that's not a bad thing. That number came down drastically, and realistically, it's probably going to be somewhere between, I'm speculating between there and, 200, 220, I think is a totally realistic number. I would love it to be, we're continuing to work to have it as low as possible, but
180 is pretty low.
where we're at.
Yeah,
Yeah,
thank you.
you're welcome.
Any other questions? All right, thank you so much.
Thank you.
Okay, that being it on the agenda, can I get a motion to adjourn? Second? Do we have a second? All right, meeting adjourned. It has a thing.
Something.